Good evening, everyone. I'm Shraddha Shetty, head nutritionist and lifestyle expert working with Blue. Thank you so much for joining me in today's session. I want to start this session by asking each of you to recollect how your day goes by, or probably even someone close to you. How does their day look like? Do you wake up feeling tired? Do you rush to work? And maybe because of all of this, you miss your workout. And then once you step out, you're just so hassled with the traffic around you, or maybe you're hassled with the kids or house help, everything else around you. And then once you probably reach work, you're just so stressed with all the workload that you tend to take smoke breaks in between, or maybe eat unhealthy snacks, or even skip your meals and then land up overeating later. All this plus end up working for late hours, and then you're angry at people around you. Probably then at the end of the day, just to relax yourself, you're just binge watching TV. So all of this happens, and ultimately at the end of the day, you're going to bed very late in the night. Now, all of this, does this seem similar? Is this you, or probably even someone close to you? Does the day sound similar to any one of you? At least for me, it does sound familiar because a lot of people around me definitely have such kind of days. I want you to, probably put down in the chat box if you yourself have such kind of a day, or someone close to you has a day which looks like this. So, what do you think? What kind of lifestyle are we leading, or are these people leading? Is it not a stressed lifestyle? Like from the time we wake up till the end of the day, we are just stressed the entire day. Now imagine, like, what does our heart go through this to cope with this stressful lifestyle that we have? And do you know that our heart is just the size of our fist, like just this much, So imagine this small organ, what it has to go through the entire day when we are just tackling all these things. Now our hectic or our bad lifestyle can have us make us very prone to lifestyle related disorders like high blood pressure, high cholesterol, type 2 diabetes, obesity, etc. Now, all of which over a period of time can increase your risk of heart diseases and make it very dangerous for your heart, basically. So now, what are some of these heart diseases? Now, heart diseases could be a disease of the blood vessels, which could be a coronary artery disease, or it could be the heart rhythm issue, which is arrhythmia, that is irregular heartbeat. It could be disease of the heart muscles also, which is called as cardiomyopathy. It could even be heart valve disease. Now, talking about heart valve disease, do you know the sound that the heart produces? I'm sure most of you know it's called thak thak, right? What we find it very familiar. So now medically, this thak thak is actually lup dup. So now this sound that is produced is basically your heart valves opening and closing. So that's when the sound is produced. Now this sound or this function of the heart valves, when there is a dysfunction, so this disease is called as heart valve disease. Talking about that, just a few days from now, that is 22nd of Feb, is actually the National Heart Valve Disease Awareness Day. So this is to increase the awareness of heart valve diseases, which is very common, and it needs to be treated and taken care of as early as possible. But what is shocking is that even with so much awareness, heart disease is the leading cause of death. And it's all because because of the lifestyle that we follow, and we don't take care of our health so much. This is very much preventable, and I understand that there are certain risk factors that you cannot control, like your age, your gender, or your family history. But there are a lot of risk factors which are completely in your control, which being your diet, your body weight, your physical activity, your blood pressure levels, cholesterol levels, your diabetes management, your smoking habit or drinking habit, sleep, emotional health or stress, and of course, your other overall lifestyle related things like the four pillars that we discussed about. So now, talking about all these risk factors, let's begin the session with talking about a very important thing, our diet. Now, when we talk about diet or any of these lifestyle changes, it's not particularly for people who have an existing heart problem. It is for each and every one of us that we need to follow a heart healthy lifestyle. Talking particularly of the diet routine that you should be following, you should definitely be including a lot of fresh food in your diet. Now, it could be at least 1 or 2 portions of fruits in a day, 2 to 3 cups of vegetables per day, including whole foods like whole grains, your whole wheat, jowar, bajra, etc. Plenty of whole grain options, whole pulses, beans, legumes. These are all rich source of nutrients and even fiber. Now, fiber is particularly very important because that's the one which is going to help to keep your blood vessels clean. So fiber, very important. So try and opt for as much as whole produce as possible because that'll have the maximum nutrition and the maximum fiber also. You also want to take care of including healthy fats in your diet. Now, it comes from your nuts and seeds, omega-3 rich foods like fatty fish, flax seeds, walnuts, chia seeds, even avocado. So these are all the healthy fats you want to include. And of course, all your cold pressed oils like olive oil, coconut oil, and even our homemade ghee. These are great for our heart health. Moving further is your inclusion of non-vegetarian food. So if you are a non-veg eater, then you want to opt for lean meat like chicken and fish more than your other meat like red meat. Now, there is always a debate whether you should go for plant-based diet or meat-based diet. Definitely plant-based diet is much more healthier. But if you are a non-vegetarian, then it's not that you have to completely cut off from meat. You want to have a good balance between the two of them. So if you include non-veg food in your diet, then you want to definitely cut down on red meat or processed meat like sausages, salami, deli meats, and all of these things. And you want to definitely include a good portion of vegetables whenever you're including a meat-based diet. So there has to be a good combination. Try and limit your non-veg food intake to say 2 or 3 or 4 times in a week, depending, of course, on your health condition. But you definitely want to cut down on your overall meat intake if you want to work towards a healthy heart. Talking about the things that you want to limit, you want to definitely limit the intake of excess salt. Now, excess salt, not just in food, but even what comes from your packaged food, even your excess of sauces, pickles, papads, and all these things, you want to limit that. You want to also limit excess of sugar. Now, especially refined sugar, but you want to also limit the products that you have because a lot of these food products have hidden sugars and even hidden salts. You want to read the food labels very well so that you are able to limit and cut down your excess sugar and salt intake. Apart from this, you want to also limit your intake of refined flours. So like we discussed, try and offer whole foods, whole grains, whole pulses as much as possible because the more processed the grains or any product gets, it gets depleted out of its nutrition and even fiber content. So you want to limit your intake of refined flours. Apart from this, you want to limit or avoid your intake of unhealthy fats like hydrogenated fats, which is margarine and vanaspati, all these things, plus trans fat also. You want to limit your intake of foods like fried fast food items, packaged food, chips, etc. So these tend to have trans fat in it, which you definitely want to avoid. And like we discussed, you want to limit your intake of red meat and processed meat. So these are few things that you want to limit, and some of the things which we discussed earlier, what you want to include in your routine. So have a good balance. Moderation is definitely the key. You don't want to do excess of anything, even if it is the healthier things. Talking about diet, let's move on next to body weight, which is very related to the diet that we follow. So body weight, if you're overweight, especially around your middle, that is your belly fat area. So your belly fat, you want to keep it, on the lower side because that makes you more prone or makes you increases your risk of having heart diseases and other lifestyle related disorders like we spoke about hypertension, high cholesterol, diabetes, obesity, etc. So you want to be careful of taking care of your middle, that is reducing your weight, of course, and focusing on the belly fat as well. So don't jump to, becoming size 0 or something, but you want to gradually work towards getting to a healthy weight. Moving next, very important to get to a healthy weight is physical activity. Now, regular physical activity, as you know, will help you to lose that excess weight. And it will also help to improve your fitness levels, your stamina. And when it comes to heart health, particularly, it will help to improve your good cholesterol. That's your HDL cholesterol. And it will help you to lower your bad cholesterol, which is LDL cholesterol. It also will help you to improve or manage your blood pressure. Apart from this, as you know, exercise is a good mood booster. So it'll help you reduce your stress and improve your emotional health too. So when we talk about physical activity, there is a little difference in physical activity and exercise. Now, physical activity is something that you do, say, on a routine basis, like you're just, walking to get a glass of water, or you're doing your household chores, or you're doing some gardening. So your routine activity. So that's your physical activity. When we talk about exercise, it's something which is more targeted, which is more planned, or which is more, structured. So exercise is something that has to be a more targeted approach. And the American Heart Association, in fact, it recommends that we should aim for at least 150 minutes of moderate aerobic activity every week. So now this would, if you had to break it down, so it would be 30 minutes of walking, say 5 days a week. So your moderate aerobic activity would be like a walking activity that you can do at a brisk pace. And it also recommends either you do this 150 or you focus on 75 minutes of rigorous aerobic activity, which could be like running. So if you had to break it down, then it would be, say, 15 minutes of running 5 days a week, or 25 minutes of running 3 days a week. So you could make your own combination, of course. The latest edition that is there by the American Heart Association is 2 or more days of strength training sessions in a week. So this would include your body weight exercises like doing squats, push-ups, lunges, etc., and weight training, whichever works for you as a strength training workout. So now, this is a standard recommendation. You, of course, want to tweak it as per your medical condition, as per your fitness level, and gradually work towards increasing your activity levels. And when it comes to breaking down these exercises, you want to definitely, if you are a beginner, start slow, because the whole intention is to move more and sit less. And you want to definitely space it out also better through the week, and not that you just do 2 days in a week, you complete all these things, and then the rest of the week you're not doing anything. So you want to definitely plan it out well spread throughout the week. So when we talk about moving more and sitting less, it's a great way to keep a track of your step counts with the help of, say, a fitness band or a watch, which you can wear on your wrist, and keep a track of your overall step counts for the day. Now, these fitness bands also have, some of them have a heart rate tracker as well. So some people do get too obsessed with it. So I don't want you to get very obsessed with that and keep checking it very often. But just to get an understanding, your normal resting heart rate, which is basically when you're just sitting, you're not doing any activity. Maybe like you've just woken up and then you check your heart rate. That's your normal resting heart rate. That can be anywhere between 60 to 100, which is normal. Now, for people who are like well-trained athletes and all, they may have lower resting heart rate also, maybe even like 40 beats per minute. Now, this is because they've trained their heart so much that now their heart is able to work efficiently even with that lower heart rate. Now, this is about the lower heart rate. Now, when you're working out, when you're doing any activity, your heart rate is, of course, increasing. Now, when this heart rate is increasing, the maximum heart rate that your heart can maybe withstand is calculated with a very simple formula, which is 220 minus your age. So supposing if you're 20-year-old, so 220, your maximum heart rate would be 200. If you're, say, 30-year-old, your maximum heart rate can be around 190. So this is how you would calculate as per your age. But when you're doing an activity, you're not trying to aim for the maximum, but you're trying to be anywhere between 50 to 85% of the maximum heart rate, depending on the intensity of workout that you do. So this is just to get an idea. Don't try to get too obsessed with the number and keep checking it very often. So this is just to get an understanding of what kind of activity you're doing and how much it is helping you to bring up your heart rate, and then if there is scope for more improvement. Yeah. Moving next to a very important risk factor that we need to work on is managing our stress levels. Now, stress, as we all know, that it is a major factor for our heart diseases or any other lifestyle related disorders like blood pressure, diabetes, etc. So now a lot of people, to cope with the stress, maybe they resort to drinking or smoking or overeating or maybe, other substances. But that's not the right way of dealing with your stress. It's so unhealthy that you're putting your heart, even further at risk. So, what are the healthy ways of managing your stress levels? Now, you would want to try and express as much as possible to your family or your friends, or maybe to a professional counselor, or maybe join a support group. You could also very simply just, practice meditation, visualization, and other relaxing techniques at home, which is very simple. I mean, of course, if you are willing to do it, it's quite easy to follow because you don't need too much of a professional help here. You could, just listen to some guided meditation and follow the meditation practice, which will be very beneficial to calm your stress and make you feel much better. Apart from this, of course, physical activity, like we discussed, it is a great stress buster. So you can try and include good physical activity in your routine. Apart from this, of course, include some hobbies that you really enjoy or any other activity that makes you happy. That's very important. So look at that me time, or that, time you spend doing your hobby, which really, just makes your day. So something like that, try and incorporate in your daily routine. And don't just send LOLs or rolling on the floor emojis on chats. You want to genuinely laugh out loud. So it could be just watch a funny movie, or maybe crack some jokes with your friends, or just join a laughter group. I'm sure you'll find at least one of them in your nearby park. So definitely you want to include laughter in your routine because that's great for your heart. So try and work on these simpler things rather than complicating with, indulging in other things and spoiling your health further. So work on these simple tips. And another relaxing thing for your body is to get good and enough sleep. So you want to work on sleep because we know that lack of sleep can do more harm to our body than just leaving us, yawning, right? So it does a lot of harm to our body, and chronic, deprivation of sleep can really increase our risk factor of heart diseases and other lifestyle related disorders. So you want to ensure that you are getting good quality of sleep, not just quantity, but quality sleep also. About 7 to 8 hours, depending on your age and everything too. So you want to ensure that you get good quality sleep. Try and set a sleep schedule, like, going to bed at the same time, waking up at the same time each day. So this really helps to set your body clock. So sleep, very, very important. You want to work on that. Don't sit till late nights, binge watching Netflix or other shows and everything. So try and cut off from these light emitting devices, at least few hours before you go to sleep. And practice other, relaxing activities, what we discussed, to reduce stress levels. Another important thing, or two things rather, which you definitely want to work on is firstly quit smoking. So if you smoke, definitely you want to work on, breaking this habit or just quitting it, because smoking does no good to our body, right? In fact, smoking, in fact, lowers your HDL cholesterol, which is your good cholesterol, and this is, the protective cholesterol actually for your heart. So imagine that each time you smoke, you're depleting the protective layer of your heart. So definitely you want to quit this habit if you want to protect or take care of your heart. Second thing would be to limit your alcohol intake. Of course, alcohol also has to be in moderation, or if you're, not into it, definitely you don't want to get into that habit. So make sure, alcohol intake is also very, very limited, because we all know that alcohol also affects our body negatively. So work on these two habits, which is definitely in our control: smoking and drinking, something very unhealthy for our body. So you want to work on quitting it, or at least limiting it. Apart from this, what I really want to emphasize is that if you are taking any medicines for high blood pressure, or for your cholesterol or diabetes, do not try to fidget with it by starting, stopping, altering the dosage on your own, because with that improper knowledge, we can do more harm to ourselves than benefit sometimes. So you want to take the help of your doctor if you are on medicine, simultaneously work on your lifestyle so that you can gradually wean off it if possible. But keep your doctors always in the loop, because you don't want to fidget with it, because there was a reason why you were put on it in the first place, right? So you want to work on your lifestyle and gradually work towards weaning off it if you're getting better results with the lifestyle changes that you're doing. And the last thing that I want all of you all to work on is to find out your bank balance. So now bank balance, right? So I'm sure most of you know how much money you have in your bank accounts, but do you know your bank balance of your health? Do you know how much HDL cholesterol you have, how much LDL cholesterol you have, and where all you should be investing to improve these numbers? So the only way to find out your bank balance of your health is by getting a blood test or a health checkup done. So make sure you do your annual health checkup. If you're even a healthy, young adult with not any, existing conditions, you should definitely plan an annual health checkup. And of course, if you have a particular health condition, then you want to be extra careful. At least every 3 or 6 months, make sure to, get your levels checked so that you know you're on the right path. So don't forget this, which is very, very important, because that's the only way you can, understand. By just looking at a person, you can't make out that this person's HDL will be high or this person's HDL will be low, because even the skinniest of people have very bad cholesterol levels. So you don't want to judge by just looking at a person. You want to test it and then only find out. I want to leave you with a very nice fact. Uh, did you know that the first organ that is formed during the development of a fetus or a baby is the heart? So the fetal heartbeat, in fact, you can detect it on an ultrasound as early as 6 weeks after conception. So imagine your heart, this small organ, is there from right at the beginning of your development till the end, and it's going through so much each day, beating each minute for you and doing so much good for our body. But it's time that we start taking a little extra care for this small organ, which is our heart. So I hope this session and all that we discussed today helps you to take a little extra care for your heart and make it a heart healthy, body. You want to work on having a healthy heart for yourself. That's it from my side. Over to you, Tina.
Thanks so much, Shraddha. I thought that was amazing. I think the tips that you've given are really, really valid, and I'm sure a lot of people would be able to use that in their everyday lives. We do have a couple of questions that have come up.
Okay.
The first one is, what precautions should people take for those who have undergone an angioplasty to avoid blockages from reoccurring?
Right. So all the tips that we discussed today, in fact, applies to, like I said, not just someone who, has an existing heart condition, but for each and every one of us. So especially if you have a condition that, and you've gone through an angioplasty, you want to take extra care of all the parameters, be it your diet, be it your physical activity, stress, sleep, everything applies. Nothing is, different for someone who has had an, angioplasty, or, who's just trying to make a healthy heart. So it's just that you have to be extra careful about these things. And of course, when it comes to your activity, make sure gradually with, discussion with your doctor, you work on your physical activity also. So that is very, very important.
Excellent. Thanks for that, Shraddha. I know you mentioned, our health bank balance. I think this question will be, linked to that. So why are so many fit people like Remo D'Souza, Saurabh Ganguly, Kapil Dev, etc. We've heard a lot of them have had heart attacks. So what is the reason behind that?
Right. So we are just seeing them superficially, right? We don't know what exactly is happening in their lifestyle. Are they really getting that enough sleep? Because we know that they are working hard, they are active, but are they getting that right amount of sleep? How much is their stress level? Are they able to handle it? Or does it really bother them? These are important factors. It may seem small, but these also tend to affect you a lot. Now, those were their active days, like Kapil Dev or Saurav Ganguly. Those were their active days. Now, how active they are, how is their diet now? I'm sure at that time they must have taken some good care, or maybe probably if they had not taken care at that time, could be that was like a cumulative effect now. So you want to, always start now. Don't wait for something to start and then make changes. So what you do right now may not reflect immediately, but may reflect after a few years too. So you want to work on, correcting your lifestyle from now itself. So don't look at the superficial things that you see that, okay, they look good on screen and, they are so active, but what do they do, once they're off the screen or once you're not seeing them? You don't know what is going on in their life, right? So it won't be the right way to judge.
All right. Thanks for that, Shraddha. There is another question on the pulse rate. So this particular person has had a high pulse rate from uh, her teenage years at about 110. So what lifestyle changes would you suggest to slow it down? There is chronic anxiety from a very early age as well.
Right. So definitely you want to work on, handling your anxiousness that you have. You want to practice relaxing techniques like we discussed, meditation, visualization, and other techniques, wherein you work on your overall emotional health. And of course, I hope you have shown it to an expert and taken the right guidance, what you need to do if you have a higher pulse rate, normal, resting pulse rate. So you want to definitely take professional help for that. But when it comes to managing your heart rate in general, if you have a higher one, then you want to take care of your breathing. So you want to work on relaxed breathing activities, like focus on doing simple basic pranayama, not very strenuous ones. Like don't start with Kapalbhati or something, but relaxing ones, which will help to calm you down and bring your pulse rate down. So focus on breathing exercises, meditation definitely. And I don't know if you're into any physical activity, but if you're planning to start, then go very gradual. Do not jump to very high intensity, and let your heart, get adapted to this physical activity level, and maybe it'll stabilize with that.
Okay. Thanks for that, Shraddha. There is one other question that's related to the previous one we had on heart attacks. How do we know, that our heart is susceptible to, some kind of risk? Do we have any symptoms, or, do we notice anything in our bodies? Is there some indication?
So this indication will be slightly visible with your blood reports if your levels are off the chart, especially your lipid levels and other markers, inflammatory markers. So you want to be careful with that. You could, of course, have signs of maybe, frequent shortness of breath, feeling too fatigued, or having any, of course, chest pain or something, or weakness in the arms, particularly your left arm. So such things, you want to be, observant about. And definitely, like I said, you will not understand by just looking at a person or how you're feeling, how your lipid levels are. You may be feeling great, but maybe your lipid levels are not, in the range. So you want to work on correcting this. And the only way to find out is by getting a blood test done or any other health checkups. Like if you have such symptoms and you want to go in for further testings like ECG or 2D echo or something. But at least the blood test will give you some idea. But if you have further symptoms, then you want to go in for further testing also.
Right. That's great. Thanks so much, Shraddha, for giving us this information. With that, before we could, call it a call, if you could quickly recap some of the main points you want to give our listeners, that would be great.
Sure. All right. So today, since it was a discussion on heart health, we discussed about all the risk factors that we have in our control. So, of course, they include your four pillars: your food, your physical activity, your body weight, your other practices like working on your sleep, stress levels, taking care of your blood pressure, cholesterol levels if you have diabetes. So all these things are very important. Now, most of these lifestyle disorders, if you see, they make you very much prone to getting a heart disease over a period of time if this is not handled well. So you want to, take care if you have blood pressure, if you have high cholesterol, or if you're having diabetes, and you want to ensure that these are under well control, like be it with medicines if you need to take them, or definitely with lifestyle. So you definitely need to work on these lifestyle related disorders so that they are under control and they reduce your risk of having a heart disease. And the other things are your diet, physical activity, and your body weight. And if of course, basic things like you want to work on quitting, smoking and reducing your alcohol intake. So these are definitely some of the things that you have control over. The other things that we don't have control over is age factor, gender, maybe your ethnicity, or even if you have a family history. We don't have control over these things. We can't change these things, right? We can't change our age, we can't change our family. So we, at least these things we don't have control over, but there are a lot of things like we discussed which we have complete control over. So we have to take charge of our health and get great control over these things and work towards reducing heart disease, because that's shocking that it's the leading cause of deaths in the world. So we definitely can work towards it, and it is very much possible if we all decide to do it, if we all decide to work on our lifestyle and have a very healthy heart. So that's about our session today.
All right. Thanks so much, Shraddha, for taking the time out to explain all of these functions in detail. And I'm sure a lot of us will be able to take away from this session and also make use of the tips that you have given us. So thank you once again for making the time for us and sharing these important features. So with that, we'll wrap up this call for today. Once again, I want to thank everyone who has joined our session this evening, and a big thank you to Shraddha as well.
Thank you, everyone. Thanks, Tina. And don't forget to check your bank balance.
Thanks.